Please welcome Cherie back to the stage.
What a great segment we just had, and following on that segment, I have up here with me some of state directors, Georgia commissioner, who are leading the charge in their areas around suicide prevention on a state level and pushing down their programs locally. So I wanted to introduce them to you today, and I would like for you to hear about what they're doing in the areas that they're in, and also hear about the different cultures of where they are, because they are spread geographically as far as it possibly can be and everywhere in between. So with that, Tish, would you start with introducing yourself?
Yes, I'm Trish Ross. I'm the Commissioner of Georgia Department of Veterans Service.
I'm Verdi Bowen. I'm the Director of Veterans Affairs for the state of Alaska.
Hello, I'm Joe DeVito. I'm the Outreach Director for the Indiana Department of Veterans Affairs.
Good morning. James Hammer Hartzell, Marine Corps, 37 years, and I am the Executive Director of Florida's Department of Veterans Affairs.
Thank you, guys. So we had a discussion when we did our prep call of how we wanted this panel to go, and these guys want to hear from you. They want to talk to you. So I wanted to let you know we're going to spend about 15 minutes. We're going to open it up, send questions as they start talking into the chat, and we're going to allow about 15 minutes for you to engage and explore more about what they do. Before we get to that, I'd like to start with like teasers almost about what you're doing in your respective areas. What types of prevention or collaboratives you're doing? Who would like to start?
I can start. So in the state of Georgia, we, like the other states here, are part of the Governor's Challenge to prevent suicide. We've been part of that challenge for a number of years. Had a slight hiatus due to COVID, but we are back and in force. Some of the things that are unique about Georgia and some of the ways we are trying to partner is we have a higher rate of lethal means suicide. We're at 80% for firearms, which is, of course, above the national average, even for veterans. And so that's an area that we're really trying to focus on is not only the gun locks that we get through SAMHSA and the VA, but partnering with our local pawn shops, gun dealers to be able to have safe storage, especially when somebody knows that they're at risk. They can give their gun and they can have it held for a while. Or in transition, so maybe they're PCSing. That's something that we're doing. We're also in the Bible Belt. So we're very engaged with faith-based groups just because that is great connectors for a lot of our men and women who have served or who are serving, but also to inform our faith-based leaders that sometimes just saying, well, you know, the military's edict of just suck it up, many of our faith-based groups just say, you know, well, trust in God. You're not evidently not trusting enough, that is not a good response, and that we need to surround our men and women with the supportive services that they need.
No, thank you for that. And I think that's a great point, particularly around the faith-based communities. I know I work with Hammer in Florida on the Governor's Challenge, and I'll let him share. But that is one of the places that we have been, you know, working closely with. A lot around because there's stigma, right? And in order to, you heard yesterday from the panel yesterday, but we got to break down the stigma. That's the first place for prevention. So thank you for bringing up the faith base. So I don't want to steal your thunder, Hammer. I'm gonna, if you would talk about Florida and what we're doing.
Great, thanks, Cherie. And I'm blessed to have Cherie on our Governor's Challenge team. You know, in 2019, we were among some of the first states that accepted the challenge. I'm very fortunate, very blessed in Florida. My governor is a Navy combat deployed veteran, Ron DeSantis. He understands deployment. He understands family separation. He understands watching families suffer while they're worried about people away overseas and dealing with life. And it doesn't even have to be deployed overseas, but it's just away from family. You know, the disconnected part of it. He lived that. He understands that. So he's a great supporter, and his wife too, Casey DeSantis. So we put together our team. We built I feel, a very strong team, and it's very diverse. And diverse by I mean local people serving and wanting to help prevent suicide, state level, and then national, federal level entities. And we put us all together into a room, and we came up with a plan under the great templates that we got from the Governor's Challenge. And we have different teams, and the main thing that we're focused on is identifying who our veterans are. My biggest challenge is we have 1.5 million veterans in Florida, plus their families. And it's a very different state culturally. The people, my veterans who are in South Florida, Miami, Broward, Dade County, are very different from my Panhandle veterans and their families. And all of us have that kind of diversity in our state. So what we found is we need to find our veterans, and how do we find them and who they are and where they are? Because we can't reach out to them, as the family was just talking about, to reach out to the families and to the veterans after they come off active duty and move into our states if we don't know who they are and where they are, right? We don't want that to be discovery learning at the hard time when they're in severe crisis. So once we know who they are and where they are, then we need to communicate with them, and we need to address them and connect with them. So it's all about connections. That's what we learned in the military, and those of us who have lived families in the military, it's about connection. So there's so much I could say about that, but so the main focus we have right now is connecting our whole state together at all levels to find our veterans, and then to reach out to them to keep them connected to each other. And it's a challenge. It's a growing challenge. One of the things in Florida, we have the fastest growing veteran population in the nation. More veterans are moving to Florida than any other state, according to the data that we're receiving. So I have a huge influx of veterans and their families coming in. I don't know where they are. I don't know who they are until somehow we find them through different data sheets, information. So it's a huge challenge. We're striving to get that because we want to, again, get ahead of the crisis by keeping veterans connected and engaged.
And I'm glad you brought up the diversity of the Governor's Challenge in the group that you brought in. I get asked a lot of times when people want to bring partners together and collaboratives together, and you walk in and it's only direct service providers that are sitting at the table. And direct service providers, while they're important, do not make up our community. There's not law enforcement there, or maybe an individual from law enforcement, individual that maybe represents a large company. If it's not diverse, then you're really not holistically able to kind of like leverage that collaborative. So thank you for bringing that up.
And one other quick thing that I just thought about, we've also learned with the Governor's Challenge and reaching out, and there was state entities already who are dealing with suicide prevention. We have a state suicide prevention coordinating council, and we were the veteran voice in that council, but then we focused with our Governor's Challenge in a bigger way. And what we learned was talking to an 87-year-old Marine father like mine, who just passed away this past year. I couldn't text him or email him or send him anything social media. He had no idea what that was. I had to mail him something. I had to physically talk to him about something along these lines. That generation. My 36-year-old Marine son, if I sent him something in the mail, you know where it went. The garbage can. He never looked at it. It had to be electronically. It had to be through the social connection, social media connection. So that the voice, the connection has to be very, very diverse to the different areas, and then culturally diverse. Language, everything. So we've learned that we have to reach out. Not just one tool does not fit all. It doesn't. And that's why we have to work on this.
Valverde, Hammer said he doesn't know where all the veterans are when they're transitioning in, but you do, don't you?
Well, fairly much so. Most people believe Alaska's large, especially those people who live in Texas. Alaska's very large. It's interesting. I'm listening to the Governor's Challenge. Prior to the Governor's Challenge, we just entered into the Governor's Challenge. My governor wanted me to jump into it to find new venues or new ways to help our active duty. Because most of you, if you watch the news, you notice that we have a military installation in Alaska that was #1 in the nation last year for suicides. And that really sort of caught us all off guard because we don't do a lot of work on the installation except for those people that transition. So we had to have a different way of thinking. You know, that's the great thing about the Governor's Challenge is you have to have new blood, I guess, at the table, if you will, or new ideas at the table so you can start developing out. What we have done in the state prior to the Governor's Challenge is that we did something a little different. Most people don't realize, well, you probably do because you guys watch most of the reality shows that's in Alaska that they have on TV, because that's generally people will ask me questions if I know those people, which I probably do. But the thing is that it's really difficult getting into certain communities in Alaska because a third of our communities you can't drive to. You have to take a plane. And sometimes you have to take a very small plane. Or you have to wait until the winter comes and so it freezes up so you can take a snow machine to that place. Unless you're in Minnesota, I think they have snowmobiles. We just have snow machines. And the thing is that we do have difficulties with access. But the best thing about this is the way we shrunk the state, and this will help you. We went out and started training volunteers in all of our communities called Tribal Veteran Representatives. Now, that's not an original idea by me, by no means. I actually borrowed it from Oklahoma. And I brought that in and started training people throughout the state. Well, what went along with that is I also did Alaska Native healthcare sharing agreements. I'm one of the few states that have the least amount of VA presence. We have 5 clinics in my state, and that's it. We don't have a hospital. And so what we did is we started doing sharing agreements with the Native hospitals and the Native clinics so that we were able to provide health care to our veterans where they live, especially off the road system, because up until then, they would have to get on an airplane to fly to Anchorage just to do simple blood tests. Now they do them at home. So what we did is that we first of all energized those volunteers in the community, because you know, if you live in a small closed community, there's always someone there that knows who everybody is. I don't know how that works, but you know, when I was a little kid, we didn't have telephones, if you can believe that, but you didn't need a telephone. We used to call it village telegraph. If I got in trouble on one end of the community, before I could get home, my mom already knew. So how she knew, I don't know, but I just know that's the way the communities work, because the children are the ones that generally pass through the stories faster than the telephone will. And the other thing that we have is hammer-hit technology. There's a lot of my communities don't even have technology except at the schools. And even then, it's limited there, and we have it at the clinics. So that's the key center in our town. And so we had to go back through and look at ways that we can impact those communities. And the last thing that we did, along with our volunteer service officers and our healthcare agreements that we have within the community, we started training our clergy in each one of the communities on suicide prevention. We started using them whenever we had someone that had a suicidal ideations in the community. We would reach out to the clergy in that community to engage with that person directly, because the only way we can prevent suicide is one-on-one connection. You know, they have to be looking at someone in the face to stop them. Now, we all know that that last hour is the most difficult time, because if you're not standing there in the room with them, it's hard to prevent that. So we started looking at ways upstream to start working with these people before they got into crisis, which meant that you have to catch them when they lose the job, or when they're having family issues, or they're having other life things come along. And it really made it a lot better for us to be able to have someone in the community to reach out to. So now as I look across my state, which it actually shrunk it, I have 3 people in each state or in each community that I can reach. I can either reach clergy, my tribal veteran representative, or someone in the local clinic, so that they all know that person, so it makes it easier to reach and grab those people.
Great, thank you, Verdi. Joe, will you talk to us a little bit about what you're doing?
Yeah, I sure will. You know, we are in the latter end of our first year in the Governor's Challenge in Indiana, and one of the things Hammer alluded to when he used the word template is what's one of the great things about the challenge. The team came in and they present a template, but they also very much encourage something that we really took a hold of, and everybody seems to have, is to customize it. And you know, you understand your state, you understand the diversity in your state, and it gives us the opportunity to create a way to present the challenge, how it's going to work for us. And what we've done in Indiana is we're as diverse as any other state. We've got Indianapolis, Fort Wayne, up in Gary, Indiana, very city-like environments. We have extremely rural areas. And one of the things we know in Indiana is we're very strong with the county model. We have 92 counties in Indiana, great county governments, great county veteran service officers in each county, a partnership with them and IDVA that's been building over many years and is extremely strong. So, we're looking at the governor's challenge in a county model. So we're breaking down the 3 priorities of the governor's challenge. One is identifying service members and their veterans and their family members. Second one is creating connectedness, and the third one is lethal means training. And it's a lot more in depth in each one, but those are basically the 3 priorities. So we're breaking down partnership with other state agencies and other organizations. One of the greatest things about the last 3 days being here is hearing everybody talking about partnership and collaboration, and it's so true. I mean, everybody here, every organization, every state, we can all do great things, but we can achieve greatness if we do things together, and that's what we need to do. So we're going into each county. We're presenting to county coalitions. We're beginning with counties that have established coalitions right now, focusing on suicide prevention, suicide awareness. We're presenting to them the governor's challenge, presenting them the 3 priorities, and we're starting with that identifying. Most important thing, how do we identify those folks? We've had great programs like Ask the Question that we're working with in our state who's helping lead the way on that. And what I've noticed is when we want to ask agencies, service organizations, anywhere, doesn't have to be veteran, especially non-veteran ones, hey, ask if that person has been in the military or if they have a family member that's served in the military. That's the easy part. The tricky part is what if they say yes? So now do we ask that person who's maybe at a completely different office to now close a screen, open a screen, and gather information for them? Now we're diverting them from their mission, whatever they're there to work with that person from. So what we're doing is we're coming up with a QR code system. So we're going to provide everybody with desk stickers and tabletops and cards. So if they say yes, we ask them to zap that card. Then you can move on with your business. We'll capture them, and then it'll be on our end to dig deeper, get some more information from them. So we're trying to simplify that. And then the other option is, the other thing we'll present is the last 2, connectedness and lethal means training. And we're going to empower that community and that coalition to decide which one of those to tackle first. And when they do decide one, we'll have our own templates and ways and hopefully some funding to help them go on a 6-month, 12-month, 24-month, whatever they feel, with our help and our guidance from our team to develop their plan and move forth to tackle that initiative and be there to guide them along the way. So we want that buy-in from our local communities. And we'll do that, and we're going to learn as we go. I mean, we got some great ideas, but until you start implementing is when you learn. So we'll start with our established ones. We'll start learning. We'll create our system, hone it, refine it, and then get to the point where we can help create those coalitions in counties that may not have them, and just kind of learn as we go and move forward on those initiatives.
I think that's great. And to Hammer's point earlier about it's different in Tampa as it is in the Panhandle, prioritizing by county, you're looking at individual communities, one size fits one, and where you have your priorities, you may have to tweak them a little bit, right? You may outreaching to this community may be different than outreaching to that community. So thank you for bringing that point up. I think that was really great. You guys are in all different. Tish, I didn't catch how when you guys started the Governor's Challenge.
Yeah, back in 2019.
Okay, so Florida and Georgia have gone through basically they call it maturity stage, right? They've gone to maturity, and Alaska and Indianapolis you're in your first year.
First year.
Yeah. Okay. No, this is great. If you have questions, make sure you send them in the chat. We're gonna spend just a few more minutes. I want you guys to give like some extra thoughts, like anything that you wanted to mention that we just didn't have the opportunity to, and then we'll open it up for questions.
Okay, if I could start, some of the unique things we're doing here in Georgia, we are the proud recipient of the Staff Sergeant Fox Suicide Prevention Grant. And how we're rolling that out is through collaboration and partnership. We have a great institution, the Advancement of Military and Emergency Services Research, that's tied to one of our institutions of higher education here in Atlanta, that will help us with that identification of, where the hot spots are. Is it geographically based? Is it based on, age, era of service? Where do we need to focus our efforts? So they're definitely going to be helping us with our research, as well as getting out and training through all our 53 offices, and then through all of our partners, because of course we've got community partners that are engaged with us as well. So we're excited about doing that. Another thing that's unique to the state of Georgia, and I see Tim Craig over there in the corner, is we have Veterans Education Career Transition Resource Centers, so VECTOR centers, that help with that transition process. So they not only take active duty, get them trained in high demand career skills and trades, but they help them with that transition right before they leave active duty, but they also offer that same training and wraparound services to include us within Georgia Department of Veterans Service, the VA, as well as United Way, other nonprofits. They started with one center in central Georgia where they do have housing for both veterans and transitioning active duty that are going through their programs. But this week we opened the second center in Marietta, so here in the metro Atlanta area, and announced that a third center is going to be open in the Columbus area. So for those of you familiar with Fort Benning, that's a state initiative that is funded by the state, as well as some private partnership funding. And so that's been a tremendous resource to try and tackle some of these issues and get ahead of, again, those crisis situations where now we're really helping folks with that transition whenever it occurs. So that's something that's a little bit unique to Georgia. Thank you.
Well, Alaska, again, we're back to different again. We don't have the big programs because we have to do it individually, and collaboration is the only way we can do it. We have special collaboration with people like the Cohen groups and individual licensed clinical social workers throughout the state, so that we can put mental health care as close to the veteran as we possibly can get it. It does me no good if I can't provide them the service where they live. And many times we'll run into places where we don't have any of those social workers there. And so we have to rely on telebehavioral health. And we do have some pilot programs we've done in some of our island communities in Southeast Alaska. And I'm one of those people, if I can get it to work there, then I can get it to work anywhere within the state, because they're really limited with bandwidth. And so we have really worked closely with all of our social workers. We actually have to do it almost one-on-one and sign agreements with them in order to get them in place for the veterans wherever they're at. And we can't forget their families, because many times, the spouse and the children also need assistance as well. And I only have 4 vet centers, and the 4 vet centers do a great job. They actually carve the state up, if you can believe that, into different areas, and they send their outreach people all around the state. And they also take iPads with them when they go, so that those family members also have reach back into the vet center to those doctors that are in there to help them with their transitions. And so, and then again, we rely really heavily upon our native healthcare system as well, because it's probably one of the most robust that I have within the state, so that we have that one-on-one connection.
That's great. So I guess we're talking a little bit about what we do in our state. So, the collaboration and partnership is the key. We're super lucky to be downtown Indianapolis, which, by the way, Indianapolis has the most veteran memorials and monuments than any other city in the nation besides Washington, D.C. So, and we're lucky enough that our building is housed in the original American Legion headquarters, which was built in the 20s. And we had seen many iterations since they built the new American Legion headquarters across the mall. We call it Big Brother because it's a lot bigger than our building. But in our building now, it's been redone, and it's the Indiana Veterans Center. So as far as that collaboration goes, it's one of the only buildings in the nation where we house the entire state Department of Veterans Affairs. We partner with the federal VA. We have a VA HUD-VASH clinic on the second floor, medical clinic in our building. We also have VA benefits, VA Voc Rehab, and VA HUD-VASH counselors all in the same building, as well as American Legion VFW, DAV, and we also have some other partners and nonprofits all in one building. So we get to collaborate all the time. Also with our partners at Department of Workforce Development and InVets, who work on employment and work with transitioning veterans on employment, and also work with employers. So it's incredible to go to work in the morning in that environment and have everybody in an entire building on all 4 floors dedicated to working for veterans and having a full flow of communication. You go to any floor in our building at any point in the day, and people from other floors are mixed and matched and going to see each other and talking. And, you know, getting our programs out that we do is important through those partnerships, and us informing folks of programs that other folks do. So again, it's just all about collaborating and understanding what other folks do, so you can tout what they do, so you can spread that. You don't have to do it because you know a guy, right? I'm from Jersey. We know a guy too sometimes. Someone was alluding to that from Chicago. But yeah, so it's great to know someone and be able to create those handoffs for veterans, for families, so that you know other people who do what you do. And that's kind of that approach, and all the way down to that county level again. So we want to make sure we're delivering veterans to their local resources, to our resources, and through that partnership it's the easiest and greatest way to do it.
Thanks, Sheree. You know, what we learned 3.5 years into the Governor's Challenge is across our state, there's a lot of people wanting to do something to help prevent suicide. At the city level, individuals, nonprofits, community, regional, state level, national level, VSOs, everybody's working really hard on this. But some cities and counties have no idea what's happening right next door to them. And that's my responsibility. I take that on to help get everybody to understand best practices to reinforce success. We throw in the military, you throw your reserve to reinforce success. You don't throw it into where you're failing. So we've gone and found so many partners, like with our VISN, our VA VISN partners, and the great work that they're doing in the hospitals and clinics, the faith-based groups, all of that, you know, and sharing that information amongst each other, and then making those resources and how to connect those resources available through websites, through communication, through mailers, and everything else. If you ask me what if I could fix it for a day, it would be have a PSA, public service campaign, on veteran suicide prevention. You know, when I was growing up, when I didn't have the gray hair, when I had Joe's color hair, you know, it was Mothers Against Drunk Drivers. And as a kid, I knew if you're going to drive drunk, take their keys. I mean, I knew as a kid. I mean, so we need that kind of a campaign, I feel, and we're focusing on that in Florida, in our state. We're trying to get an awareness campaign through education training. You know, we've got legislation that we've got enacted now in our state through our legislative body on what we created, the Florida Veterans Care Coordination Program. It's a long-term but care coordination program. But legislatively now, I'm responsible and accountable and authorized to pull together all these entities and share success and reinforce success with state funding even, or other people who want to contribute to that. Our call centers, our crisis call centers, you know, like our crisis center Tampa Bay is a great example. The 211 call centers, we had, I think, 13 or 14 across the state, and they would get those calls of, hey, I'm dealing with life, I'm getting evicted, whatever the crisis is. And we had some centers that had veterans. So what we did, we said, well, that's successful. So we got legislatively funded money to get veterans in every call center. So one of the first questions you're asked when you call into a crisis center asking for help is, you know, question 1, question 2, question 3, are you a veteran? Are you a family member of a veteran? Yes. Hold on. We're going to let you talk to a veteran. And then they open up. And when veterans talk to veterans, they'll tell more. And that veteran's been trained to listen more about what they're hearing. The other thing is we just got funding in the state of Florida this past year to train all of my county veteran service officers and all of my veterans claims examiners, those people that are getting those veterans are getting off active duty and they're wanting to file a claim, they're wanting to connect to their VA benefits. We are putting them through a training program on how to listen. When you're talking to that veteran, here's some key things you may hear, and here's what you need to do because you may be dealing with someone who's in a crisis that we have to do something with. Here's what you do with that information. The other thing is, what do you do with the information you get, family members? Who do you call? So it's all about a public awareness, a campaign to let people know it's okay to talk about suicide prevention. In fact, it has to be talked about. It must be talked about. It needs to be talked about. So that's why I really appreciate American War Partnership and Operation Deep Dive. And Florida is one of the 8 states that they went and they dove deep into our information in our data to help us understand better where the reporting needs to be and where the actual issues are, demographically. Last thing I just want to say is what we learned with the hurricane. My governor's team, I told them, hey, I have this conference. Can I go? And they said, yes, absolutely, Hammer. Go up there because this is important, veteran suicide prevention. Now, I will be driving back tonight, this afternoon. But what I learned was in the hurricane, because I was just in Port Charlotte day before yesterday, with the governor, with the different teams, when America is in crisis, we pull together. People put politics aside, they put other things aside, and people step up and help. And guess who's at the front of that line down there? Veterans. Our veterans are the ones who are stepping up, stepping out, and helping, going door to door, checking. That's what we need for suicide prevention, is that access and that interest and that motivation to do that. It's in all of us when we know it's a real crisis, and we do it when we really need to do it. And that's what I want to see. And I'm going to build off of that and what we learned at the local, state, and federal levels and what we're doing to help our Florida citizens recover from this disaster is let's dovetail into that. There's other disasters. There's going to be further angst and problems and emotions that come out of this as people are waiting for their house to be rebuilt and they're waiting for all those things. That's going to frustrate veterans. And we have to be with them for that. But we're going to connect because we're already connecting. Sorry to ramble so long, but yeah, there's a lot going on down there.
I know, that's great. Thank you. So we have a couple of questions. This one is, we've heard a lot about social isolation and connectedness as a key driver of suicide. What about other factors like economic insecurity and loss of daily structure? Anybody like to take that?
I guess I could take that to begin with. As I was coming down here, Hammer talked about the storms. We have storms that hit our West Coast, wiped out quite a few of our communities. And when you talk about food insecurities, it's really huge. For me, food insecurities is that I have to actually watch the salmon runs as they come into the center of my state. Because if the salmon runs don't come, then those people that live in those communities that live off of those rivers, like the Yukon and the Kuskokwim River, needs different accesses. And so we will work with the National Guard to get the commissary. We'll do commissary rounds. We'll take C-17s and 130s and Black Hawk helicopters out to those communities and take them food that's less expensive. If you buy the local food that's in the local stores, most of us here in this room have never seen a gallon of milk that's $15. But that's what you'll find. And after an emergency, it's even higher. So you have to be very in tune with what's going on in your communities, or else you really do have those extra crises that come along. And the next thing is that we have problems in the wintertime with heating oil getting into some of our communities. And so I have to watch that really close, because if the barges don't get in, then we have to find an alternative way to get there, or else we end up with the next crisis, which is the veteran or their families in crisis. And so it's something that the onus is on myself and my staff and all that work out in the communities to make sure that we stay in tune with that.
We've got quite a few, so if you want to wait for the next one, or would you like to say?
I was just going to mention too, connecting folks, and one of the ways we're working diligently to do so is we have a program called our Military Family Relief Fund. It's a fund that's seen a lot of iterations over the last many years, but we finally honed it to a great point now where it's, veterans within 2 times the poverty limit veterans and veteran family members can apply for up to $2,500 for an emergency financial situation. That program, along with some of the specialty programs we've done with it, was a holiday program where it was $150 per family, $200 per child. We just did a back to school one where it was $500 per child in the household that we were giving out to folks who met those poverty or those income guidelines. But the great thing about that is, A, we're helping out in a situation, but when we get those folks and those applications in, now we get to link them. We get to understand them. So part of the application is we can see maybe they need financial counseling. Maybe they need, maybe they're spending a lot of money at a particular store that sells beer and liquor. Maybe they're jobless. Maybe they need some job help. We can help them with our folks at Work One. So it's a way for us to not only help them in that moment, but help address some of the reasons why they're in that spot, and then use our network of connections across the state, whether it's VA, whether it's state, whether it's nonprofit, whether it's any local opportunity we can to hook them up with some help and get them into the system, and then learn them and connect them to other folks. And sometimes whether it's peer-to-peer, whether it's, like I said, financial counseling, but we can connect them, find them, and now we've got an open communication with that veteran we may not have had before. So
Engagement, and you're looking at the whole of the veteran, and that's great. Thank you. And that may answer the question that there was a second part to the question, and I think that may have answered the second part to that question was what kinds of dialectic approaches are you taking to support vets and their families experiencing suicidality from issues other than connectedness? And I think, Joe, you may have touched on that. Does anybody else want to add to that?
Yeah, that's a great part of the training, I guess, the corporate awareness, community awareness, is you need to know what the triggers are. You need to know what to ask, and that's what that is, that connectiveness. Disconnection is the problem. Things cause disconnection. It could be emotion, it could be spiritual, it could be mental, it could be financial, economic, it could be family, schools. Things cause veterans to feel disconnected, and that's when they get into a hole. So in our training programs that we're putting together, we're saying, how are you disconnected? And that's not what we say. Cherie, how are you disconnected? But there's triggering questions that training can say, wow, they are disconnected in this area. That could then lead to a problem. So that is part of it. Like the Firewatch training program that we've partnered with, a great program out of Jacksonville, Florida, you get military Firewatch. Even all the services know what that means. And you take the online training, and it helps you with those questions. What do you need to listen for? What do you need to think about when you're talking to a veteran that helps trigger, wow, I need to do something with this information. And you get a certificate, you become a watchstander, Firewatch stander. And we're doing that across the state with a number of different places. But part of that training is, what are some of those triggers? What are things that disconnect veterans from life and what they're dealing with?
Great, thank you. Have any states found good ways to find veterans moving into their state? Bertie, why don't you talk about the stipend?
Well, I have to say Alaska cheats, because within 2 years, I'm going to know who you are. Most people that enter the state of Alaska within 2 years are filing for the permanent fund dividend, and so they receive a piece of the oil royalty. So in June of every year, I get a list of every single person that applies for that dividend, and it also tells me if they self-identify as a veteran or not. And a lot of people do identify as veterans, and we place that into a special database in my office so that we do outreaches. We send them emails, we send them text messages, we send them postcards, especially if we're going to their community so that we can connect. That is probably about the best way that we can do that. And there's something that I've been working with the director of the VA healthcare system, is that we're now trying to get into a place where we can start sending them letters to let them know the local services that the VA is offering, along with my office as well. And we do a lot of collaboration there in order for us to do that, and it's very helpful. This is also shared with, I don't see, Amanda might be in here, I can't see, there she is. In my state, we have you have the American Warrior Partnership, we have the Alaskan Warrior Partnership, which is just an outstanding program because they actually are the key holders of all of our nonprofits in the state. So that when we have someone moving into the state that has issues, we have them get a hold of the Alaska Warrior Partnership, which will put them in touch with someone that might have funding or resources within the community they live in.
Great. And just for the rest, we've also got Keith with the Panhandle Warrior Partnership in Florida, and we've got Matt Hall with the Indy Warrior Partnership as well. America's Warrior Partnership was awarded the Fox grant as well, and the community branches within these states will be executing that within those states. Okay, we have 2 minutes left, but I really like this question. Okay, so let's do like a real quick one, but I want to do round robin with all of you guys on this. It says, what would be of interest in hearing from the panel are some examples of more holistic programs within their state versus the traditional clinical approach of prescribing medications that often have suicide risk side effects.
Okay, so we're about to open what's called a transition support unit, state funded. It's actually in central Georgia in Milledgeville, and it's going to be holistic for primarily our younger veterans suffering from PTS, mental behavioral health issues, traumatic brain injury, first of its kind in the nation, run by a state. The good news is it's not time bound. So a lot of our partner organizations, we have tremendous programs, especially here in Atlanta, that help with those issues, but often you'll time out or it's only a outpatient program. Ours will be inpatient until that veteran and their family is ready for them to go back into their community. But the reason why I say holistic is we're bringing in faith-based. It's not only occupational, speech, physical therapy, but we're doing recreation therapy. It is getting them ready to, again, go back into their community. So we're opening that at the end of the year. That is something that Georgia veterans will be able to take advantage of, and will bring in all of those different elements to help specifically with those folks experiencing any sort of trauma.
Okay, I see we're almost out of time, but I'll go ahead and answer real quick. In my state, because a third of my state is Native, it's really interesting because we use a lot of Native programs in a holistic approach in order to reach our veterans, especially those that come back from combat. We're able to utilize those programs. I just sponsored a program called Canoe 2022, where we took combat veterans and put them in canoes in Southeast Alaska, and they paddled into a community that was several islands away. And in the process, they go through a healing process that they can go through to help them reintegrate back into their communities. The great thing about that is that it uses no medication. It's using the peer-to-peer support group. We have another group that is called Healing Hearts and is done through South Central Foundation. And that program is designed exactly the same way. It takes them out into the wilderness of Alaska to help them to re-engage with themselves. And they have counselors there, of course, but it is a non-medical, medicine-based program. And then we have another one that's on the peninsula that's the same way. And most of those programs are fairly long. They're, somewhere between 2 to 3 weeks, sometimes even longer. And we also have the Alaska Veterans Organization for Women that has outreach programs too as well, that they go out and work. And those help people reconnect. And it is it's 99% peer-to-peer. So it helps, a veteran to veteran, helping those veterans reintegrate back into their communities and feel much better about themselves.
Joe, you want to?
All right. Yeah. When we're focused on, when we talk about our connecting veteran to veteran connection, we look at that from, once again, that county approach where they understand their area. So we want to be able to offer them in that area options for whether it's social connection, a recreational connection, maybe a service-based connection, or if they're looking for more of a clinical connection. We're also morphing ways that we can introduce to them, not just vet to vet, but specific programming and activities that are vet to community and then community to veteran. So really connecting veterans to the community they live in. Vet to vet is important, but they're part of that greater community. And so to make that connection is we find that to be important.
Yeah, and one of the things when we got into the Florida Governor's Challenge and we learned and we used the template and we tailored it and customized it and everything was the reeling of alternative therapies. We had to really, really, really work hard in helping veterans who are struggling, mental, emotional, spiritual, psychological, whatever it is, the stress they're dealing with. Old school way was to give them medicine, opioids or whatever it is, just to address the effects, the outside effects, I call them. Where we're focused on alternative therapies, where we put state funding, state resources, and then follow-on care after that veteran goes through that alternative therapy to address what they're struggling with, their crisis, what's inside, I call it. to continue the connection with them to the community and to others. It's not just a one-stop, hey, you've been treated, now we move on to the next veteran. You know, things like hyperbaric oxygen therapy treatments, and we put state funding into that to treat veterans with that. Canine therapy, equine therapy, music therapy, art therapy, all the different things, because it has to be tailored to the individual veteran and what they're dealing with. And one size doesn't fit all. And then, so we were really excited about doing that, and then we realized, but we have to follow on with that veteran after they've been through whatever that alternative therapy is, and that's what we're focusing on now.
Great. Well, thank you guys very much. This has been a great conversation, and appreciate all that you're doing in your states and all of us working together. So, thank you guys.